Hi, this is Broqsten Bunt, and I'm doing this video today because I have been diagnosed with a meningioma brain tumor. It's in this part of the back of my skull on the mastoid bone, in the sigmoid sinus, affecting the jugular vein drainage. According to the MRI imaging, the tumor is approximately 2 inches by 3 inches. Diagnosed as a meningioma, a recurrence of meningioma. Radiation induced is the cause from childhood radiation therapy to cure blood cancer in 1995. So the backstory: I had the first one removed in 2019 by Dr. Dutcher in West Palm Beach. This new bump was noticed in January of 2026, and I had a MRI scan done to check to see what could be the cause, and was diagnosed by the radiologist as a reoccurrence of meningioma. So I went to my primary care provider because I have a HMO policy plan. So went to my primary care provider and had them look at the imaging and give me a referral back to Dr. Stephen Dutcher in West Palm Beach to be seen to discuss the results of the imaging. So this imaging was done January 15th approximately. Saw the primary quickly, got the referral quickly. Dr. Dutcher's office was out 6 weeks to see new patients because it had been several years. Even though he'd previously treated me, it had been several years since a follow-up. So I waited until I believe mid-February. Took 4 weeks, still waited 4 weeks. Saw my previous neurosurgeon, Dr. Dutcher. He looked at the scan and immediately said, "You need a better facility and a better skull-based meningioma specialist neurosurgeon. I can't do this case, and I can't do this case in this hospital network. You need to go to Tampa General Hospital Network to get better ICU care, and you need to see Dr. Harry von Loveren." So I went. He wrote me the referral to see Harry von Loveren. So I called their office and requested an appointment. Had to wait another 6 weeks in order to be seen by Dr. Loveren, and there was some uncertainty about whether Dr. Loveren would be in network or out of network, and so we went back to the primary, and the primary got an authorization to basically do a referral from their office to see Dr. Van Loveren, and that went through their insurance people that I'm just the patient, I don't know how this works, but they basically sent me to the office with a piece of paper that said I could be seen. Insurance would accept the costs of a consultation with that neurosurgeon. So whether in network or out of network, I don't really know how that all processed, but I was seen by Dr. Van Loveren, and he reaffirmed radiation-induced recurrent meningioma, big one, necessary to have surgery, and he sent me to have several different scans: PET scan, CT scan, MRI with and without contrast, an angiogram to see how blood was flowing. The angiogram was done by Dr. Guerrero at Tampa General Hospital. That was questionable whether it was going to be approved and paid for or not. It ultimately happened. I showed up for the appointment. Admissions got us through the door, back, did the angiogram, got the results. Doctors took that results with all the other imaging to tumor board meeting, where they discussed the necessity to have this surgery and this procedure done, which introduced me to the team of doctors that would be participating in this surgery: Dr. Von Loveren, the neurosurgeon; Dr. Eric Klayman is a plastic surgeon specialist to open and close the incision to keep my hairline and my scalp healing well and put back together, as well as possibly doing any grafting that may be required to fill the void. They have to remove all of the bone that's affected by the meningioma, and any bone that has to be removed just to access the meningioma so it can be removed. It's a pretty intensive process. So we have the plastic surgeon Eric Klayman. Also questionable whether insurance would cover his expenses in network or out of network. They called before his pre-surgery consultation and said insurance hasn't given us the pre-authorization, and I'm like, we must do this, figure it out. I'm the patient. I'm not the medical office. I'm not the insurance. I'm not submitting the bill. I'm not paying the bill. You guys figure it out. Met the doctor, did the pre-op. Yep, it's necessary. Yeah, it's major. We got to do this. Happened again with the ear, nose, and throat surgical specialist, Dr. Boyev. His office called less than 24 hours before the pre-surgery appointment on May 22nd, 21st. Your insurance hasn't given us the pre-authorization to have this consultation. And I'm like, we're scheduled for surgery on June 1st. This is currently the date of this video is May 26th, so we're less than a week away from scheduled surgery date. And Dr. Boyev's office said, we can't see you, your insurance hasn't given us the authorization. That's the same story. We got surgery coming up. I have to be seen. I have to have the surgery. Look at the records. It's serious. It has to happen. This tumor has to come out. I'm not going to die from this at the age of 36. So they saw me, and yeah, we need to have this surgery. This is major. We got to do this. So every turn, every step, imaging was a problem. Angiogram was a problem. Pre-surgery appointments with the doctors were a problem. These are all the same surgical team that meet at a tumor board to discuss high risk, high severity, difficult surgeries for special tumor cases like mine. And Florida Blue has dropped the ball every step of the way with not recognizing the severity of this. The medical offices also, I know these people are doing their best, but the medical offices, I'm assuming, are responsible to submit single case agreements to get this coverage figured out. I mean, I don't know how this works. I'm just the patient, but somebody's not getting things done, and if Florida Blue is declining these things at face value because they're just out of network, I don't understand. Tampa General Hospital is in network, and I'm gonna walk you through what my insurance website shows me to show that I'm doing my part as the patient. I'm not in insurance, and I'm not in medical office billing. I don't know how this works, but it's my job to try to choose providers that are in network, and I want to show you how I'm doing that, and that this shortcoming isn't going to be my fault in the end when it's all said and done. So I'm going to put you on my Florida Blue patient portal and show you some things. So this is my Florida Blue patient portal. My insurance card, my digital insurance card there. My wife is the provider, but there's our policy number, FSO. That's going to become important later. That's my first 3 digits of my member number of our Florida Blue, Simply Blue plan. Simply Blue, all copay, 18,753. So I need to find care. Find care. Pop up. I need to find care. I want to check to see if I got providers. I want to find doctors. I'm going to pick that. Search a provider's name, edit location. So right now I'm searching my home location, but my neurosurgeon said I need to go to Tampa General Hospital. They have a better facilities, and they have what I need to have a successful outcome. The area code for you can put the hospital in there. 1 Tampa General Circle. Let's see if that's enough. If it's not, I know the zip code, but let's try that. Not this time. Cancel that. Oh, I hit the local. It's 33606. That's the zip code for 33606 is the zip code for Tampa General Hospital. Apply. There's a note here. Let's read this. It says, to make sure you're seeing the correct information, only providers who confirm the accuracy of their information with us every 90 days are listed. So we want to find a facility. Let's look at Tampa General Hospital first. 33606. Continue. Hospital facility. What kind of hospital facility do you need? Hospital. Continue. 1 Tampa General Circle Hospital. This came up. It doesn't really say whether or not it's included, but it came up as one of my providers. Let's click on this. Maybe this will give us more. Let me see if I can zoom out a little bit. There we go. Plans accepted. Your plan is accepted. Simply Blue, all copay. Your plan is accepted. So Tampa General Hospital, where I'm having all these, where the angiogram was done, the location, all of that is great. That's in network. I can go to Tampa General Hospital. Beautiful. Okay, let's go back. Now I want to check on the doctors. Back. We need, well, we gotta go back one more. That's still facilities. Back one more. Okay, we need a specialist. What location? At Tampa General Hospital, 33606. I just want to remind you, this was my neurosurgeon from the previous surgery, looked at the scan and said, you need a skull-based meningioma surgeon specialist to do this case. And he referred me, neurosurgeon in network, referred me to Dr. Harry Von Lovren for the special skills that he had for the specific medical condition that I had. So that's the backstory. Medical specialist. What kind of specialist do you need? We need a neurosurgeon. Continue. Okay, there's some results there, and it's at this location, and we can scroll and we can find the names, but I'm looking for Harry Von Lovren. I don't know these guys. I wasn't referred to these guys. Says they're accepting patients. Sure, that's great, but I want Harry Von Lovren because that's who my referring neurosurgeon said I need. So let's change hospital affiliation to TGH. Apply filters. No providers found within 20 miles. Okay. So let's, I believe I picked this, how did we get there? Let's see, it says click here to find a provider in your network. Where do you live? 33606 Tampa. And, well, that's looking for a plan. Okay, so I clicked on a link. It says you're leaving Florida Blues website, going to a third-party site. The site may have different privacy policies than what you've agreed to, blah, blah, blah. Do you want to go? Yes, sure. Okay, this is where I tried to wind up. So I couldn't find the doctor that I was looking for based on the Tampa General search. I'm using the search tools from my provider. I am now at provider.bcbs.com because I followed the links to get here from my insurance provider's portal, and it says, hi there, let's get started. Choose a location and a plan. So again, 33606 Tampa General Hospital. Click that. Yes, this is correct. Remember when I said, hey, the first 3 digits of my plan? FSO. FSO. These results are presumably going to be based on my insurance card's plan number, FSO. Continue. Okay, great. Now I'm at the place where I can search for a doctor by name. I want to find Dr. Von Lovren. V-A-N-L-O-V Lovren. Harry Von Lovren. Harry Von Lovren, Tampa, Florida, prefix plan FSO. His location, 2 Tampa General Circle. In network, accepting patients, neurosurgeon, phone number, wheelchair access, BlueCrossBlueShield.com, 2 Tampa General Circle, Harry Van Lovren, in network, Tampa, Florida, plan prefix FSO, in network. Okay, this is where I was led to believe that this wouldn't be a problem. And when they were calling and saying that there's problems with authorization, I'm telling you, I looked it up on the website. This says it's a network. Figure it out. Oh, here, one more thing. Last updated 5/25/06 Blue Cross Blue Shield. It's not out of date. It's on your website. In network, Harry Van Lovren, FSO. So I proceeded down this path with Harry Van Lovren because my neurosurgeon referred him to me as a meningioma skull-based specialist. He's highly regarded as one of the best of the best. If you look up anything about him, you'll find that his accolades are just beyond comparison. What an amazing doctor Van Lovren is. And he assembled this team of other doctors that are going to perform this surgery that's going to save my life. So, I proceeded down this path. We did all the scans that Dr. Lovren requested. We did the angiogram that Dr. Lovren requested. We did all the pre-op appointments with all the other surgeons. So the initial consultation for this, I believe, was March 31st, my first appointment with Dr. Van Lovren. So imaging was done January 15th. Appointment with Dr. Van Lovren, the initial consultation, was March 31st. So 45 days into this process to see this doctor. I waited 45 days to see this doctor. And he said, yeah, this is severe. You need this surgery done. This is what it's going to entail. Do all these additional scans and imaging, and we'll develop the surgical plan. It's now May 26th. So it's been almost another 2 months since I initially met with Dr. Van Lovren. So we're from January 15th to now into this procedure with this neurosurgeon. If this whole procedure had to start, this whole process had to start all over, find another neurosurgeon that insurance says is in network, that's qualified, that's willing to look at this imaging, that's willing to put together a surgical plan to start this procedure all over again, would put me so far back that this tumor is going to keep growing and keep getting big, and by the time I may have surgery with a different neurosurgeon, this tumor could be impeding on my ability to speak or balance or read or write, to the extent that I wouldn't even be able to advocate for my own care. And this has been an exhausting process, to say the least, to figure out how I need to go, where I need to go. It's a 7-hour round trip from West Palm Beach to Tampa just to see these guys, and I've made every appointment on time and every effort to keep them covered and assure them that my insurance is going to pay, and that because of this portal, this Blue Cross Blue Shield, providers.bluecrossblueshield, with Tampa and my plan prefix telling me that this doctor's in network, this is why I'm down this path. Let's look at another one. So the plastic surgeon is Eric Clayman. Eric Clayman, ND, plastic surgery. This is the plastic surgeon on my team. He has an office that's outside of Tampa, but he practices at Tampa General Hospital. Providers.bluecrossblueshield.com. Eric Clayman, in network. Tampa, Florida. FSO plan prefix. Last updated 5/25/26, 2026 Blue Cross Blue Shield. Yesterday. Eric Clayman, in network. Let's look at another one. Waldo Guerrero. This was my vascular neurology surgeon that did my angiogram. To Tampa General, in network, Guerrero. Tampa, Florida, plan prefix FSO. 5/25/26 Blue Cross Blue Shield. They already did the angiogram, so I don't know whether the procedure didn't get approved or not or whatever, but they did the angiogram. Says he's in network. Wasn't a problem. Let's look at another one. Castudius. Didn't come up. Let's try his last name. Boyev. I gotta spell it right. Castudius Boyev is Paul. His name is Paul. He goes by Paul. He is the says otolaryngologist. I don't even know how to pronounce that. He's an ear, nose, and throat surgeon. That's probably what that means. Met with him on the 21st. To Tampa General, in network, accepting patients. Tampa, Florida, plan prefix FSO. Last updated 5/25/26 Florida Blue. This is my insurance provider's website telling me that these providers will be in network I don't know how else I'm supposed to know, but I proceeded down this path with this is the surgical team assembled by Dr. Van Loveren to do these specialty surgeries. These guys work together. These are the people that we need to have a successful outcome to do these high risk, high severity procedures. Let me back out of this. So I've showed you all of the doctors that I'd like to be seen and showed you how my provider's website that I was linked to through my patient portal, given my specific plan prefix. I've been told by a couple of my insurance people, like, oh, this isn't the website you're supposed to be on. You're not supposed to be here. These are results tailored to my plan prefix. I don't know how, there was no, hey, warning, patients, this is not for you. This is the tool that I have from my insurance to do what they're telling me is my responsibility to determine that my doctors are in network so that I can have care. So let's go to, I'll share with you some MyChart. MyChart's been great. I've been very pleased to work with MyChart and specifically with Tampa General. They do an awesome job of documenting what has to happen from your patient end so that you can proceed. So let's look at View Journey, see what this has for me. May 19th, pre-admission testing. I did my thing, so there'll be an after visit summary. We have June 1st, procedure coming up. Procedure scheduled, Harry Van Loveren Surgical Suite, Tampa General Hospital. View details. Resection, fossa infratemporal. There you go. Resection, midline neoplasm at the base of the skull. Microsurgical techniques with microscope. Lumbar puncture, tissue graft. That's where that's Custodius. Lumbar puncture, Custodius. Stereotactic computer assisted cranial spinal, Custodius. Eric Clayman, revision of the scar, wound repair, Eric Clayman. Oh, it says Harry Van Loveren too. I missed him there. Okay, so the two surgeons working together on all of those things, with Eric Clayman being the plastic surgeon to help close up and move tissue. One thing I wanted to show you, let's see appointments and visits. This will show how far down the path that we've gone. I don't know if this is the right place. Here's my surgical team. Michael Labby is the specialized registered nurse that's helping Dr. Loveren. How do I get to my home page here? Let's try this now. Oh, that's where we were. Forgive me. Gotta figure out how to navigate this a little better. Visits. Past visits. Okay. So April 23rd. Imaging. May 5th. Conversation with Harry Van Loveren's team. May 19th. Surgical consultation with Harry Van Loveren. That was our second meeting. Pre-admission testing with the hospital on May 19th. Telephone call with Harry Van Loveren on May 20th. Telephone call with Mr. Boyev's office, Dr. Boyev's office on the 20th. Audiology appointment on May 21st to test hearing pre-op. Office visit with Eric Clayman on May 21st, pre-op. Office visit with Dr. Boyev on May 21st, pre-op. Telephone call with Harry Van Loveren on May 22nd. So if I go to surgical consult, I think clinical notes here, this is going to be helpful. So here's the backstory case. A lot of this I've already explained. This is kind of everything we talked about. Assessment plan for the meningioma. Maybe this is worth reading. This is what I wish my insurance was reading when they're sending decline messages. Meningioma, tumor in the mastoid bone, slow growth over 6 years, causing occlusion, blockage, meaning blockage, of venous drainage and rerouting blood flow. No current headache, numbness, or loss of hearing. Imaging shows tumor proximity to the temporal lobe of the brain and patent critical vein. PET scan indicates no new meningeal activity elsewhere. Plan includes surgical removal of tumor and affected bone, preserving venous drainage. Plastic surgeon will assist with closure, including titanium mesh, cement, possible grafts, discussed risk of brain injury, hemorrhage, memory loss, language deficits, infection, bleeding, wound complications. Surgery duration estimated at 7 hours, with up to 4 hours of additional if grafting is needed. Hospitalization estimated 2 to 4 days, up to 10 days if graft is placed. Initiate seizure prophylaxis post-operatively and consult neurology and epilepsy team for alternatives. Due to the, I believe this was anti-seizure medication. He's talking about looking for an alternative medication from the last time I had issues with brain fog due to the anti-seizure medication. So that's what some of that is about. History of leukemia with prior total body radiation, which is the cause of this radiation-induced meningioma history that I'm having. 2019, left craniotomy for tumor resection of meningioma by Dr. Stephen Dutcher at HCA. Near total resection achieved. Office visit 331. Routine follow-up with USF neurosurgery. So this is the summary of the first appointment with Dr. Van Loveren and his diagnosis of radiation-induced meningioma. Multiple meningiomas present. Imaging showing 8 to 9 millimeter lesion in the center. I believe tumor board documentation. So tumor board from April 1st, where these guys all met to discuss what needed to happen. Here's a picture of the left side of my brain. This is all tumor. This is tumor in the bone. We've got a report of the angiogram, reports of the CT scan. This is the PET scan. All the light spots are showing tumor, tumor, tumor. That one's the most useful. All that yellow is tumor. Left side of my head. Some patient history. Don't do tobacco, don't smoke. Alcohol socially. No medications. No other issues. Neurological exam. Everything else is good. So, insurance. We gotta figure this out. I'm not an old man with a sore tummy, a sick tummy. I'm not looking for Tylenol. I'm trying to get this special neurosurgeon to take my case, to save my life at the age of 36 so I can continue, my married life with my wife and my 2 dogs, and he's the neurosurgeon that we need. There's no reason that this neurosurgeon and his team need to be getting denied their claims to get paid. These guys save lives every day. They're working at a hospital that's in network. They're taking the case as a referral from my neurosurgeon that is in network. We've shown that we've tried to take all reasonable action necessary to find doctors that can be paid in network and be treated appropriately and paid for their services so that I can be healed and get better. So yeah, that's what I have to say, and this is going to be my story, and I'm going to push for this to go as far as it has to go until somebody with the authority to make the right call will make the right call with Florida Blue and get these guys approved and paid for their services so that I can have the surgery on June 1st in 6 days from now. Scheduled surgery is 6 days from now, and insurance is still denying these guys claims to be paid for their pre-surgical meetings and appointments, and it's been a battle every single day to be seen, to have these appointments, to keep the ball moving in the right direction with the right surgeons that have been put in my path. So Florida Blue, let's step up and get this all approved. Thank you.